Health insurance terms can sound like another language: copay, deductible, coinsurance. You've probably nodded your head when someone mentioned them, but deep down thought, I have no idea what those mean. The truth is, understanding these three terms can save you hundreds, even thousands, every year. Let's break them down simply, once and for all. Copays, deductibles, and coinsurance are all types of healthcare costs. Depending on the type of health plan you have, your out-of-pocket costs will work slightly different. Let's take an in-depth look at what these terms mean, how they work together, and how they are different. First up, the copay. A copay is a fixed amount you pay every time you get a service. Think of it like an entry ticket. A copay or copayment is a flat fee that you pay on the spot each time you go to your doctor or fill a prescription. For example, if you hurt your back and go see your doctor, or you need a refill of your child's asthma medicine, the amount you pay for that visit or medicine is your copay. The copay amount is printed right on health plan's ID card. Copays cover the portion of the cost of a doctor's visit or medication. Copay costs are predetermined rate based on health insurance. Now, the question arises, do I have to pay a copay for every visit? The answer is not necessarily. Not all plans use copays to share in the cost of covered expenses. Some plans may use both copays and deductible or coinsurance, depending on the type of covered service. Also, some services may be covered at no out-of-pocket cost. Let's get to know, what is a deductible in health insurance and how does it work? A deductible is the amount that is paid each year for most covered medical services or medications before a health plan begins to share in the cost of covered services. For example, if you have a $2,000 yearly deductible, you'll need to pay the first $2,000 of your total eligible medical costs before your health insurance plan helps to pay for costs. For example, if one has a $20,000 health insurance deductible and his medical bill is $80,000, he will have to pay the first $20,000 and the insurer covers the remaining $60,000. If the claim is for less than the deductible amount, such as a $15,000 bill with a $20,000 deductible, the policyholder would pay the full $15,000 himself, and the insurer would not pay anything for that claim. If one is mostly healthy and don't expect the need costly medical services during the year, a plan that has a higher deductible and lower premium may be a good choice. On the other hand, let's say one known to have a medical condition that will need care or have an active family with children who play sports. A plan with a lower deductible and higher premium that pays for a greater percent of their medical costs may be better. Let's check out what is coinsurance and how does it work. Coinsurance means you pay part of the bill after your deductible is paid. Coinsurance is a way of saying that you and your insurance carrier each pay a share of eligible costs that add up to 100%. The higher your coinsurance percentage, the higher your share of the cost is percent. Let's consider an example. Jane reaches her $1,500 deductible. Jane has seen a doctor several times and paid $1,500 in total, reaching her deductible percent. This where coinsurance begins. So her coinsurance plan pays some of the costs for her next visit. Jane's next visit costs $125. Jane pays, 20% of which comes to $25, and her plan pays 80%, which totals to $100. Now question arises, how do I calculate my coinsurance costs? The amount you need to pay for your coinsurance will depend on the allowed amount that a provider can bill for their service. For example, some health plans have an 80-20 coinsurance. This means your coinsurance is 20% and you pay 20% of the cost of your covered medical bills. Your health insurance plan will pay the other 80%. People who need chronic care, expensive treatments, or pricey medications will have an easier time with low coinsurance. Having your insurer paying a larger share of your costs may help you save money over time, even if your monthly premiums are on the high side. Finally, let's get to know, what is an out-of-pocket maximum? An out-of-pocket maximum is the most you could pay for covered medical expenses in a year. This amount includes money you spend on deductibles, copays, and coinsurance. Once you reach your annual out-of-pocket maximum, your health plan will pay your covered medical and prescription costs for the rest of the year. Let's check this example for better understanding. John has a health plan with a $2,000 deductible, 20% coinsurance, and a $3,500 out-of-pocket limit. Typically, John has a plan that started in January, and he sees his primary care doctor and specialists frequently. By July, he's paid $2,000 for his total medical bills, which means that he has met his deductible, and that amount is also counted toward his out-of-pocket limit. Starting August, he'll pay 20% coinsurance as his share of medical costs, while his health plan will pay the remaining 80%. He continues to see his doctor and specialists, and by September, he's paid $1,500 in medical bills, and this amount counts toward his out-of-pocket limit, too. It's now September, and John has spent $3,500 in total for medical bills and has met his out-of-pocket limit. This means that his health plan will now pay 100% of costs for covered care until December, when his plan year will renew or end. Make sure to review your health plan and benefits documents carefully. These will tell you how much your copay, deductible, and coinsurance amounts are and how you pay them. Understanding copays, deductibles, and coinsurance isn't just for adults, it's for anyone who wants to take control of their money and health. Next time you pick a health plan, you'll know exactly what you're paying for and how to save more. If this video helped, hit like, share it with a friend who's confused by insurance, and subscribe for more clear, simple finance explainers every week.